Hi, Patterson. How are you?
I'm good, Jeff. How are you?
I'm good. What's that scar on your cheek? I know you were talking about it the other day. Have you been jumping off tall
Well,
buildings again?
that's the rugged look, okay?
It's a
Um,
nice little bruise on your cheekbone.
yeah, but I kind of ripped all the way down to my lip, and so I haven't been able to shave, which is um, disconcerting to some people.
Oh, I think that's a
And,
good excuse, actually.
but we'd had a weekend away biking, and we did Mount Robertson. It's 2,600 meters up and down in the mud and the roots and the waterfalls. That was good. Next day, riding along in Picton, which is about 3 hours north of here, and follow my buddy Jeff, who's 17 years younger than me. And I just clipped a tree with my handlebar. It was very dark forest of bush, and I went flying a couple feet and landed on my face on the kind of on the trail and in the bank, and kind of like. And so I'm in the mending mode, and like I say, if you're not replacing tissue, you're probably dying early. You know?
Well, I really like that attitude because it's easy to think we're getting a bit old and we start to, I don't know, put the mothballs on or play it safe. But really, it's like keep living life, keep growing and pushing those boundaries rather than shrinking is one of the opportunities. So you're a good model for that one. Not that I want to keep falling off my bike, but
Well, it happens. Like I say, the cutting edge actually does cut. And so again, I come back. If you're not bleeding, you're probably not on the cutting edge. And I have, I think I have, 9 Band-Aids on right now from my experiences in the bush and rolling through the bushes in in the slimy mud going up a 45-degree uh, hill for 4 hours and down it. It was like, but it was fantastic. It was just like Maslow would say, it was a peak experience, literally on a peak. So
so
it's
I won't send you training wheels for Christmas then.
no,
You wouldn't use them anyway, would you?
no, but I think I
So,
need a helmet.
one of the things I wanted to really talk about was get this idea of what is lifestyle medicine out, because you talked about this last week that you're actually a fellow, one of the only a couple in New Zealand and a handful in probably Australasia. So, what's the federation or the group of lifestyle medicine? What does that mean being a fellow?
Well, that's a great place to start because lifestyle medicine is uh, what would I say? As I talked about last week, I had been doing lifestyle medicine ever since George Goodhart talked about the triangle of health, of the structure and nutrition and the psychology being the rudiments of how we stay healthy. But as I try to learn everything myself and do everything myself and create my own training organization, the International College of Prevention, Performance, and Longevity. In the background, I knew of this group that had come out of Harvard in 2004 that said that we're gonna approach this problem from the way that's not going to threaten anybody, number one. And number two, get the best results we can get to help suffering, and they came up with lifestyle medicine as the 6 pillars of lifestyle medicine, creating a holistic view of where people need to change their behavior at, not what medications they need, but where they need to change their behavior to get more out of life and make diseases less prevalent.
Mhm.
That was a fundamentally different concept. We had it in chiropractic. We had it in my group of people I was training, that we say, look, you see this here and here and here, in 10 years, 20 years, they're going to have that. Okay. And so you've got to get on it now. But these guys were brilliant. They created their organizations, and I by about, oh, I can't even remember, 2015, 14, 15, I was teaching my program. I took a look at their program that they just started to have, teaching large seminars to doctors and getting them excited about how they were presenting it.
Mhm.
And these guys were academics. They were world class. And so I said, I got to go with the 800-pound gorilla here. These guys, I can see they're going to be the wave of the future by their conversation, because that conversation was had in anti-aging medicine, but again, it was relying on hormone manipulation. It was in age management medicine, which was another group back in the late 2000, late 98, 98, 99, but they were targeting aging as a disease. And so again, but they were more holistic. If they were saying exercise and diet and stress and all these things are modifiable, and it will help your quality. So lifestyle medicine came out of that background, but solely relied on the behavioral aspects of looking at why we eat the way we do, and how could we do it better, and what's the best diet to be on. Can we educate people to do that better? B, is exercise important? Of course it is. How much exercise? Who should exercise? Men and women. What is the best thing that we can do? And if you're not exercising, how can we get you into it? And 3 would be the avoidance of risky substances. It seems obvious, but if you're a doctor and you don't have a way to have a good conversation about alcohol or drugs or smoking with the patient and the resources to handle that, you're dropping the ball. And then, of course, acknowledging that a good night's sleep is extremely important. It helps reset the body, make it healthier, and it supports the immune system. And if you, as a doctor or a general practitioner, or even a specialist, don't take into account that, this patient, I'm doing open surgery, and is only getting 4 hours of sleep for the last 6 months. That's not a good thing. You got to be able to have that conversation and say, what is sleep hygiene? How do I change that? How do I help that? Who are the people I go to and refer to? But at least I have to be able to recognize it. And then from that aspect, we go into, well, what about stress? What can we do for stress? What is stress? How do we define it? How do you as a doctor look at stress and go, stress knocks down the immune system and it increases muscle tone? No. It's much more than that. It's a hormonal mediated total thing. And there are things that you can do in your behavior to help. Exercise is great. Meditation is great. A social connection is great. Talking about your issues and your stress is great. So if you can't have that conversation, you again are dropping the ball. And lastly, your relationships. How are your relationships? Are you isolated or are you not? Are you interactive? Do you have a religion? Do you interact with people? Do you have close personal relationships? And many doctors in the field have said that the number one disease, Dean Ornish in particular, says that the number one disease of our century is isolation. And so in that, we take these six pillars and we create a curriculum studying each of these things. And there's been multiple books written, the American College of Lifestyle Medicine, which is the founding father, so to speak, of the movement, and now has, I think, 18, 19 countries that have organizations that have lifestyle medicine under their banner. And the training is set. We have set curriculums of where we can come in, and anybody can come in that's professionally trained in the field of helping people. Psychologists, nurses, physiotherapists, anybody that's got contact with people is one of those people that can be trained to learn this curriculum. And it's only about a 30-hour curriculum for the initial phase, and you have to have a bachelor's or above training, so a nurse or a doctor or somebody like that. And all doctors have to take that. And then you go for further training to a fellowship level or a specialty level. Now you can go and do a 2-year residency in lifestyle medicine. That's made by Dr. Tulk, and I believe it's in Pennsylvania. I'm not quite keep forgetting where she's from. I met her at conferences. She's brilliant. But my point being is that this is a very organized whole curriculum to teach you how to the rudiments of positive psychology, the rudiments of having a conversation with a patient. How many doctors have a conversation with their patient? Mm-hmm. It's unheard of, because your job is to come up with the 25-cent word that is the diagnosis and prescribe the procedure or the medication that is in your knowledge base.
Yeah. What I'm listening to in my own head is, way back when I was studying architecture, it was very much about the computers coming through, and it was this big world view of how technology will save us. And if you look at that in the medical thing, it was always we either took a pill or we had some surgical intervention. And back then, the alternative was this new age thing called heal yourself. And it was kind of like, I'll just be happy and everything will be wonderful. It's like, well, I'm not sure that's stopping people from dying. But what I'm now hearing is that was the principle of, yes, how do we self-heal? But now there's a whole bunch of steps and science and rigor to say this is how we help self-heal. So it does become, it becomes the obvious alternative, but they're not separate, are they?
No, they're not. I mean, my organization, Prevention, Performance, and Longevity, was our credo. And in lifestyle medicine, the first most important thing is prevention. Teach people how to have the appropriate lifestyle so that they, instead of 90% sure you're going to get it, be 90% sure you're not going to get it. That's a big difference, right? You switch the whole game. That increases performance and enhances longevity. But now, with the new research of the last decade, we can absolutely say, no. We can intervene in the disease process and make medicines and procedures work better. We can reverse these conditions and take away the medicines that we thought were lifelong, and you're going to have to take this medicine for the rest of your life, however long that be. And we can actually cure some of these conditions and make them go away with the tenets of this lifestyle. There's been enough research to say, oh, heart disease, you hit it hard and you hit it correctly, you can clear out the arteries, every artery in your body, and not have to have the chest cracked open and the 4 or 5 little arteries replaced from something out of your leg. I think that's drastic, and yet people think it's drastic to eat a plant-based diet.
It's an extraordinary thought, isn't it? Like, we're talking about like something that is expected, as in I live and I get old and I die, right? We know that's the pathway, but
100%.
That's the given bit. We all agree on that. But it's the question of, does that actually have to happen when I'm 60 or 70, or does it have to happen and I can still be happy and healthy at maybe 90 or 100?
And that is the fundamental question. One of my, I guess, most satisfying things I ever hear is that when I have somebody who comes to me and says, look, I've got serious cancer. I've been going through this program. I don't know what to do. And we look at all 6 or 7 of these pillars, because I've made a 7th pillar. And we look at this and we say, well, let's start here and just start moving you towards something that your body will like and do better with, even while you're going through chemotherapy or radiation. And 6 months later, 3 months later, people are going, I can't believe you're sick. You look really good. Your skin looks good. You're out exercising. What's going on? Are you still doing that crazy diet?
The crazy diet, right? The one that's saving you.
And of course, that's very satisfying. But people, when they are struck down, it's like a train wreck in slow motion. It only took, I was diagnosed with cancer today. It only took 25 years to to show up. And it only took 10 years to show up.
I think that's an important point because people's understanding of how disease occurs is completely off the rails, as in, I was well, I was well, I was well. Oh, today I've got cancer. I didn't have it yesterday. And technically that's correct because you now have a diagnosis. But clearly, as you're saying, it's a bunch of habits over a long period of time that were heading in that direction anyway.
Well, lifestyle medicine is based upon its ability to affect non-communicable diseases. And what that means is that chronic degenerative diseases, the things that burden our healthcare system, that doctors are horrible at managing because obesity, diabetes, heart disease, dialysis, autoimmune disorders, skin disorders, digestive disorders, these things that just go on and on and on and on and on.
Yeah.
This takes up 80 to 90% of our healthcare system. And these are the ones that we focused on with behavioral change and see outstanding results. There was a study done by Dr. Ornish who took the standard cardiac rehabilitation of 32 visits to the exercise physiologist, and he doubled it. He made it 74 visits. And in that 74 visits, he doubled the time too. So he made a harder program. And one of the problems with the cardiac rehabilitation is people drop out of the program because they just say, oh, it's too hard or not interested anymore. It's kind of rote. So in this twice as hard, twice as long program, he included diet. What was a heart healthy diet? He included meditation. He included a group of people that got together and talked about their emotions. And for that period of time, what happened is that his patients that went through this study, while it took twice as long, their results were up here. They went phenomenal. Everything stabilized. They were on less medication. They had higher output levels. Their hearts showed 4 times as much flow as the other group. They were doing fantastic. But what was even more fantastic is that because of the length of the time of the study, they got the ability to lock it in. And the 5-year follow-up showed that they were still at 80-90% as opposed to the baseline, which was, a lot of them had died. Okay. So this is the thing. So when you get in and you do the aggressive intervention, lifestyle is, when you intervene in somebody's lifestyle, you say, what can you do better? This is how it happens.
Well, the extreme example of that was, there was a TV show you might remember called Biggest Loser, and they had these obese people on TV, and they absolutely flogged them with exercise and shrunk their diet. And these miracles happened in, 10 weeks or whatever it was, where they'd lost half their body weight. It was extraordinary to see. But the follow-up on that several years back, 95% or more of those people have put back the same weight or more. So it's kind of like, yes, we can have spectacular short-term results, but what's it worth to you?
And this is where lifestyle medicine is different. We understand that we have to continue to follow up in my personal programs. We want to follow up with people on a regular basis in the beginning, and then we want to keep them in a group. I have a group of 170 fasters on my private Facebook page that we can communicate with each other, that we can get together and exchange recipes or just kibitz about anything. And that's how it should be. You need that connection. But that long-term goal of feeling part of something that actually is working. Eventually those people, after 3, 4, 5 years, they become the teachers. They're showing their families how to do it better. They're doing this. And this is the positive psychology aspect of lifestyle medicine that's in our curriculum that says, look, you can't push people unless they feel like they can succeed at something. The Biggest Loser told people they were a loser by the title, and they were deficient. And there wasn't, not that, while I admire how hard it was and how arduous it was, uh, people, the motivation behind people was never addressed
Yeah.
as it should have been psychologically. He said, you gotta
Yeah.
this person inside a healthier person, the way they think, the way they talk, the way they breathe, the way they sleep, all of these aspects. And of course, those stars of the show are the ones that have gone, they've changed their occupations, they become personal trainers, they become dynamic individuals who have bought the whole jar of Kool-Aid and gone that direction. And
Mm.
I think that that's a good thing. But where lifestyle medicine is different is that we understand that this chronic degenerative disease burden has to be tackled at the grassroots. And
Yeah.
you need to do it effectively wherever the patient comes in, wherever the individual says, hey, like you're a student of the game. You've been with our fasting group since its inception over 5 years now. You're a healthy beast, and I think I can say that you're always going to be a healthy beast because you're inquisitive and you're action oriented now, and you realize that, hey, I do this. This is just how I roll.
Yeah, I think that's a good point because it's not. There's two thoughts that come there. Is the first one is it's like how does I work with people around how to make change happen, particularly in organisations, and the studies show that change management projects basically have a failure rate of between 70-80% and cost millions of dollars every year around the world. And it's kind of like this whole model of change is the thing that's flawed because we're trying to do it in a bloody hurry instead of build this over time. And it's the same for, I didn't just start becoming healthy. I took, like what you said with your example before, I took one thing and I made that work. Then I became capable or open to another thing that worked. And it's kind of just this little thing over time. But that's also where leadership by example kicks in that it's like, I just need to prove to myself I can stick to this. Uh, But then what happens is when I keep doing that and I start showing up as, like, I'm getting people saying, hey, look how good your skin is. What have you been doing? And as soon as I tell them I fast and eat plants, they don't want to know anymore. But it's like, choose. What do you want? Do you want to have good skin or do you want to put face cream on or how do you want to live your life? And it's kind of like, I don't push it. It's kind of like, there's your option, choose. But it is the thing of how do you actually make change over time? And the key is not making the change. That's actually easy. The Biggest Loser thing tells you it's fairly easy. It's sticking it, making it stick over time. That's the real prize.
Well, coming back to Ornish's work, in one sense, it said the exact opposite. The harder you hit it, the,
Ah,
the better the results. But that was in the intervention aspect
okay. Yes.
of
Yeah.
medicine. And that intervention aspect comes with very sick people
Yeah.
that at a crucial time in their lives. The smart people see this 10, 20, 30 years before. There was a study, it just came out, it showed that people, what they do between the 0 and 20 doesn't make a lot of difference in their longevity calculation.
Mm.
As long as they're getting enough calories and not malnourished. Even the junk food eaters tend, if they make it through, tend to, which is 80 to 90% of the people, that doesn't have an effect on their overall mortality, all-cause mortality. What really happens is that people's lifestyle between the age of 20 and 70 has the most effect on the 70 and beyond.
Mm.
Okay. And that makes sense because this is where you get into the drone of habit. And if it's a good habit, that's great. If it's a bad habit, it's going to drone on until, overnight, I've got 4 arteries in my heart that aren't working. No, it just took 30 years to accumulate from your bacon and eggs each morning.
Yeah.
So, but that's my point. So the interesting thing to me now is we're talking about intervention versus education and implementation. So
Yeah.
there should be no patient that goes to the doctor for any of these chronic conditions that isn't said, well, first off, how's your weight? Are you a healthy weight? How's your blood pressure? Is it a healthy blood pressure? How's your cholesterol? Is it a healthy cholesterol? And, and in that, Well, if it isn't, why not? They'll send you to a dietitian, or they'll send you to the exercise physiologist, or they'll send you to the counselor, and let's start here. Let's give you one thing to worry. And that's how you pick it up early. And that's where you flip the chronic burden.
Yeah.
That's the most important thing, because this chronic burden is crippling the world's healthcare systems.
Yeah.
Trillions of dollars. Uh, just coronary bypasses, which may be only 2 to 3% successful,
Wow. That's pretty low.
as in changing mortality, having a longer life. It's billions upon billions of dollars in the US alone. And so when we can take these people that aren't acutely you don't need to crack their chest open to save their life, but they're in the hospital with angina, and you put them through a lifestyle medicine program, within 6 weeks, 10 weeks, the angina is gone. Sometimes as little as a few
That
days.
quick.
Yeah, sometimes as little as a few days. The angina is gone. They're walking up the steps. They're doing things. They're getting across the street. They're losing weight. And that's those interventional programs that needed to be in place, and those are happening. They're happening at different.
Because that blows me away. A, that it's possible, but B, that it can happen so quickly. Like
Yeah,
you've actually taken, let's say, 20 years to get to the point where you've got angina, but give you a couple of months and we'll get rid of it for you. It's like, how extraordinary is that?
yeah, yeah. And so it's very simple. It's a tape measurement. If your waist circumference is over half uh, of what your height is, so it's like that's not good. Okay, so you're going towards this pre-diabetes, you're going towards this internal abdominal obesity. These are the precursors of inflammation. Inflammation is the beginning of all chronic degenerative disease: cancer, diabetes, heart disease, autoimmune, whatever, vasculitis. They're all there, and we can intervene right there. We can say, let's nip this in the bud. And of
Yeah.
course, people's choice. But there's been nothing but success and validation from the scientists in the community who are researching these areas. And for me, with my interests, and I've understood that the fasting aspect has been a tremendous metabolic booster to all of these underlying issues, and helps us get to that teaching moment much better in a different way. If you do not eat, when you do eat, you pay attention to what you eat. And if you're starting to look better and you feel better, you don't want to give that back. So it's modifying your behavior.
Yeah. Yeah.
And then all of a sudden, if you're looking better and feeling better, you might actually want to go out and walk around the block because you got some energy. And
Yeah.
then when you walk around the block, you bump into somebody, a group of people that are walking around the block too. And so you create a larger social network, and it goes on and on like that. So over this course of a few years, or even a decade, people begin to have a much higher quality of life. And that's what I think is the most important thing: quality of life, a health span. How long are you going to be healthy for? I've got 7.5 years till I'm 80. Okay, that's a big number, but it's just a number. And I want to be as vibrant and as lucid as I can be. The only way I can do that is keep all the little ducks in a row.
Well, I remember years ago, this has always been the possibility I've held for myself, was you said, let's be sexy at 100. So we don't want to just get to 80 and be incompetent. And we don't want to just get to 100 and be struggling with, can't do anything. You want to actually be living till you're 80, like in the way that you're out there riding your bike still. Get that going for as long as you can. And even at 100, well, what could life be like? That would be worth living for, rather than if I'm going to be 80 and I'm stuck in a wheelchair and I don't know what day it is and I don't have any friends and I need help to poop each day or whatever. It's like, no thanks. But
Yeah.
if I can still be exercising and being social and aware and thinking about what's going on, I'll take that. Um, and we don't know where our limits are at. I think this is what's exciting. It's exposing, you could almost say, the limits of our diet approach, but we're actually in the other side of it. We don't know what the limits of this other approach is, the lifestyle medicine approach.
No, we don't. And I believe that in in the future, you're going to see that, okay, we know that the lifestyle we need to lead is this, and we need support in that. And there's many more micro industries developing to support that.
Yeah,
Like you do a chef that teaches you how to make 6 meals in your kitchen and takes you to the market and shows you how to buy them and shows you how to read the labels. That's an easy process. You go through it once or twice and you got it locked in. Then you expand your repertoire. I can get somebody to show you how to walk or run or surf or whatever you like to do, or play pickle or
pickleball.
well, and these are things that are tangible. And tangible, anything that puts a smile on the dial gives you this. But people feel so crummy in the environment they're living in. They don't have a lot of smile on the dial time. Their body's hurt, they're inflamed, they're overweight, they have hypertension, and they're working on chronic degenerative disease. This is anybody from 20 on is doing this. And we won't even go into childhood obesity. That's a whole separate separate topic. But yeah, this is where it starts. So we have solutions, and that's a good thing, is to make the mark there.
Yeah. And I just think it's about sharing some of these stories of people who have actually, you know, succeeded, not necessarily come back from illness, but also like yourself, where you've kind of got both, haven't you? You've come back from illness, but it's also that at whatever age you are, you're still active and flourishing in life. They're the stories
The
we need
last
more.
10 years, have been the best. I'm stronger, faster, fitter than I was before. And it
Wow.
came down to going totally plant-based and vegan, so to speak, and letting my body deal with that. And it thrives. So why give up the thrive, right? There's books
Yeah.
written, thrive, right? But the thrive is where it's at. You want to emulate the things that allow you to be better.
Yeah.
And once you enjoy being better, learning more, participating more, all of a sudden you're going to be helping those around you. And again, this comes back to that connection, that love element in our lives that's so powerful. So that is, move more, eat less, stress less, and love more. That's again, I talked about Dr. Dean Ornish's credo there, but
It's not a bad life.
not a bad life. No. So I think that kind of gives you a good overall macro view of lifestyle medicine, but I think we'll need to drill down on each of those things and explain them to people so that they can understand that, oh, it's just not more getting 8 hours of sleep a night or 7 hours. It's like, how do I do that when I'm having insomnia? And besides Viagra, insomnia medications are right up there in the top three. Insomnia, Viagra type medications, and antidepressants. So Prozac.
Well, we'll talk about that next week.
Great. And I will look forward to that. And in the meantime, enjoy your pickleball. I know you.
I loved it today.
Okay. All the best for now, and I will talk to you again.
Yeah, great to talk to you, Patterson. See you soon.
Bye for now.